How is malaria linked to socio-economic environments? Socio-economic factors will influence the level of risk of contracting malaria. Malaria is known as the disease of poverty and has the greatest effects among the world's poorest countries. Housing quality and occupancy. Small houses, often with overcrowded rooms for sleeping, are a large factor in the high concentrations of malaria in poor countries. Additionally, poor housing quality with floors made of earth and sand and roofs of grass and palm leaves also doesn't assist in keeping a clean environment. Unsanitary conditions. As malaria is a communicable disease, unsanitary conditions are a significant factor in determining how and how fast malaria spreads. Poor sanitary conditions, such as defecation in open settings, will attract a large number of mosquitoes. Occupation. Agricultural workers are more exposed to mosquitoes generally, and in the poorest countries, on average, over 60% of the population work in farming, as of 2017. Rural against urban. Generally, those living in rural areas are more at risk from dying of malaria, but contamination rates in urban slums are actually higher. Age and gender. These aren't so much associated with infection rates, but more so morbidity. For example, children under 5 are more likely to suffer from malaria than adults are. Ethnicity. Prejudice against specific racial groups may result in people obtaining different levels of health and education, thus making some more at risk from suffering of malaria. Income. There is a very strong positive correlation between income and the use of prevention methods. As expected, those with higher incomes will spend more on mosquito repellents and insecticide-treated nets to reduce their risk of infection, while poorer farmers, who are already at the most risk, will not be able to afford these protection aids as they receive seasonal incomes at harvest time and therefore can't obtain these during peak malarial season. Education. People with a clearer understanding of how communicable diseases spread will put greater emphasis on hygiene and sanitation. For example, in Malawi, homes without mosquito nets were most common where the head of the household had not completed their primary education. Distance and accessibility. This also correlates strongly with rural versus urban environments, as if people live further away from clinics and hospitals, they will therefore seek less treatment for the symptoms and eventually most likely die of the disease. In conclusion, having low socioeconomic factors such as poor education and unsanitary conditions will ultimately increase rates of infection and deaths from communicable diseases such as malaria.